Hello, everybody. This is Gary. Today is Monday, December 26, 2022. It's 4:46 p.m. Eastern Standard Time in the United States and Rochester, New York, and this is my coping with schizophrenia blog entry for today. Today, my psychiatric symptoms are not that bad. I went for my daily walk and exercise. I also did some shopping for some items that I needed. When I was outside, my paranoia and delusions were not that bad. I didn't think anybody was following me, plotting against me, spying on me, or laughing at me or talking about me. My auditory hallucinations that are bare minimum. My depression and anxiety isn't that bad today. Um, it's still cold out. It is December. I was just talking to a friend of mine who lives in Buffalo, New York. I'm in Rochester, New York. Buffalo, New York got hit by 6 or 7 feet of snow. Rochester has hardly gotten any snow. It's certainly cold in Rochester, New York, um, but so far there hasn't been that much snowfall. And there's been plenty of snowfall across the country. But Buffalo was particularly hit bad. But, anyways, my psychiatric symptoms are not that bad today. I have been assigned a new psychotherapist who I'm seeing on Wednesday, which is the day after tomorrow on the 28th at 12:45 p.m. My old therapist will be there too, just to make the transition a little bit smoother. Um, I have not changed psychiatrists. I have the same psychiatrist prescribing my meds, and I have a peer support specialist who I'm still assigned to. A peer support specialist is somebody who has a mental health diagnosis and is hired as a counselor on staff at the clinic I go to. Um, she has OCD, obsessive compulsive disorder. My diagnosis is schizoaffective disorder. Um, like I said, I did do my physical therapy exercises. I did some work on my computer. Um, I talked to my friend from Buffalo on Facebook because I prefer to talk to her when I can see her face. I haven't seen her in several years in person, and I was planning to visit her this spring to just touch base with her and see how she's doing. Buffalo's not that far away from Rochester, New York. It's a pretty quick bus ride or train ride to go from Rochester, New York to Buffalo, New York. Um, my friend is having back surgery, and I wish her well. She will be having back surgery on, I believe, January 19th, 2023. Um, but she's in a certain degree of physical pain. Um, but she spent the past 4 days or so without any electricity because the storm in Buffalo was so bad that a lot of power lines were down and a lot of people in Buffalo didn't have any power. I'm not sure how many people in Rochester, New York, had to go without power. My power never went out. I'm lucky in that regard, I guess. I had during the windstorms and the cold and all the rest of it, there was no power outage. I live in downtown Rochester, New York, and as far as I can tell, no one in the downtown area lost any of their power. Um, but a lot of people in Buffalo did, and a lot of people across the country in the United States lost power. Um, but it's this kind of thing that makes winter more difficult for people who have physical pain or mental illness or both. Um, the physical pain in my arthritis, my upper and lower back always seems worse during the cold weather. I had knee surgery on May 13th, and the pain in my right knee seems to get worse with the cold weather. I mean, I'm not in that much pain. It's been a while since the surgery, and my arthritis is pretty well controlled with Tylenol and the occasional Motrin tablet. I'm not taking any opioid painkillers, but I am taking some medication for muscle and nerve pain. I take some Malta for nerve pain. I take Flexeril for muscle pain and back pain, and I take Neurontin for physical pain. None of those are opioid drugs. None of them are controlled substances, um, but they help me control my physical pain. Um, so I'm not seeing my primary caregiver. I don't think until like February or March or April of next year. I have no immediate need to see her right away. There's nothing going on physically that I need to see her right away. I did spend some time in the hospital a couple of weeks ago because I thought I might have internal bleeding because I had black tarry stools, but they did a CAT scan of my abdomen. They couldn't find any evidence of bleeding, and they ran other tests. They gave me an EKG. They did some blood tests. They didn't find any evidence of internal bleeding or heart problems or liver failure or kidney failure or anything like that. They wanted to keep me for observation, but I declined. A few days later, I ended up in psychiatric emergency. Once I was there, I had no choice but to stay there, even though I was there voluntarily, because you can't leave the psychiatric emergency room until you're actually evaluated by a social worker and ultimately the psychiatrist. And after about 26 hours, they did let me go home because I did have two psychiatric appointments the following 2 days after that were already set up with my peer support specialist and my therapist, who, as I mentioned, I have to change. They gave me a week and a half notice that I was getting a new therapist, which kind of pissed me off. I wish I had been given more preparation time than a week and a half, but it is what it is. But that's all the report for now.